I'm Sherry Boschert, reporting from the annual meeting of the American Academy of Child and Adolescent Psychiatry. Several studies presented here report that programs to bring psychiatric services into primary care offices are making huge inroads. Dr. David Kay talked about one example in New York, the Child and Adolescent Psychiatry for Primary Care program.
And so we have a 1-800 phone line for docs across the state to call about their cases. We're open Monday through Friday, 9 to 5, and if they have a question about a referral situation, our liaison coordinator can help them, link them with services. If it's a question more appropriate for a child psychiatrist, what med should this child be on? They're having this side effect. Is this the appropriate treatment? They'll talk to our child psychiatrist. The second piece is a formal education piece. We have partnered with the Reach Institute in New York, who has put together a wonderful, interactive, intensive program that we called a mini fellowship in child and adolescent mental health. We know there's a tremendous unmet need. We think primary care is a great place to do this.
Dozens of similar efforts across the country take a variety of forms. Dr. Stephen Pliska described one of the largest, called Services Uniting Pediatrics and Psychiatry Outreaching to Texas.
This was a statewide project involving many private and public pediatric practices. A master's level mental health professional, a licensed therapist, was placed in each of these practices. And they were also trained to recognize those conditions that might need psychopharmacologic intervention. The psychiatrist would then make recommendations for medication treatment that would be shared with the pediatrician. The pediatrician could then in turn consult further with the psychiatrist. Our two main findings were, first, that for the sample as a whole, the 4,000 plus kids who participated in the evaluation project, we saw significant reduction in psychiatric symptoms and also improvement in quality of life. And then for the subset of roughly 2,000 kids who were treated with medication, we found that the pediatricians accurately prescribed. That is, their use of medication was consistent with the diagnosis that had been arrived at by them and the mental health professional.
Reimbursement is a roadblock, but hopefully a temporary one, these physicians said.
Integrated models really build on moving away from a simple fee-for-service model where each specialty is funded to do one small aspect of care, and really needs a more holistic approach. I think that given some of the changes we're seeing on the national level, it's conceivable that something like that may well emerge, and certainly within the next 5 years.
Dr. Teresa Hargrave, one of the founders of the New York program, has seen the impact and value of these collaborations.
If this program had been in place when I was a primary care pediatrician, which I was for 30 years before making the switch to child psychiatry, I might never have needed to make the switch.
Reporting for IMNG Medical Media, I'm Sherry Boschert.